Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 3rd, 2025. This video is on a JAMA article published online June 23rd, 2025, titled Diagnosis and Treatment of Type 2 Diabetes in Adults, a Review. Global prevalence of type 2 diabetes, about 589 to 828 million people. 1 in 6 US adults is affected. Diagnosis: when the hemoglobin A1C is equal to or greater than 6.5, fasting plasma glucose equal to or greater than 126 milligrams per deciliter. 2-hour oral glucose tolerance test equal to or greater than 200 milligrams per deciliter, or a random plasma glucose equal to or above 200 milligrams per deciliter with symptoms. The American Diabetic Association and the WHO require confirmation via 2 separate tests. Asymptomatic onset is common. Screen those above the age of 35 years or earlier with risk factors. Risk factors include age, obesity, family history, sedentary lifestyle, and high-risk ethnicities. Treatment evolution from metformin to dual incretins. Metformin remains first line due to efficacy, cost, and safety. SGLT2 inhibitors and GLP-1 receptor agonists are recommended early in patients with atherosclerotic cardiovascular disease, heart failure, or chronic kidney disease. GLP-1 receptor agonists or dual GLP-1 receptor agonists are preferred over insulin due to weight loss and low hypoglycemia. Up to 1/3 of the patients eventually require insulin due to beta cell failure. Newer agents, example tirzepatide, reduce hemoglobin A1C by about 2.5 and cause greater than 10% weight loss. Lifestyle interventions: no single best diet, Mediterranean, DASH, low carb show A1C reductions of 0.3 to 0.5%. Medical nutrition therapy reduces A1C by 0.3 to 2% over 6 months. Physical activity, about 244 minutes per week, lowers A1C by 0.4, about 1%. Direct trials showed 46% achieved remission with a low-calorie diet. The Look Ahead trial, lifestyle changes reduced kidney disease, improved quality of life despite neutral cardiovascular outcomes. Cardiovascular, renal, and glycemic targets: hemoglobin A1C less than 7% reduces microvascular risks such as retinopathy, nephropathy, and neuropathy. Intensive glycemic control benefits diminish in the elderly, the frail, or low life expectancy. SGLT2 inhibitors, GLP-1 receptor agonists reduce major cardiovascular events by 10 to 26%, heart failure by 18 to 25%, and chronic kidney disease outcomes by 24 to 39%, so double digits and more. Metformin and pioglitazone are likely to have cardiovascular benefit. DPP-4 inhibitors are cardiovascular neutral. Time in range, 7 to 180 milligrams per deciliter. The goal is greater than 70% with continuous glucose monitoring. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.